I want to introduce you to our patient, Tony. And Tony, we've already done a video on yours, so this is an update video, but why don't you just refresh everybody's memory on what you're like before you came in and all the doctors that you saw. And Tony's in our fibromyalgia recovery video. If you want any information on it, you can go to tulsafibrorelief.com and you can download a report on all the different labs and treatments that we do that's helped Tony. So why don't you talk about what it was like before you came in to see us?
Okay, I'm about 4 years into this situation with the fibromyalgia, and to get diagnosed with that, I've probably seen 10 different doctors at least, and most every doctor acts like you have, or they have no idea what you're even talking about, so that doesn't give you any hope.
Right.
And all they want to do is basically just throw a drug at you and see what happens.
And did they give you some medicine, and what medicine do you remember?
I don't remember particular medications other than just the typical ones, like the...
Did they give you like Lyrica?
Yeah.
Okay, yeah. So you tried all those and the Neurontin and all that stuff, and that didn't work.
Yep.
So then from there, what lab tests and what diagnostic tests did they do?
I've had numerous blood tests done. I've lost track of it. Nothing ever showed anything. Everything always showed normal with me. But I obviously knew something was wrong just by the way I felt. And I just felt absolutely miserable.
Mm-hmm.
So...
how did it affect, like, overall, like, well, first of all, you had brain fog, right?
Oh, yeah.
Okay, all right. And then memory issues, and then stomach issues, and then sleep issues, and then just, like, the way that you felt, you just didn't feel good, right?
The worst thing is all my joints just literally felt like they were broken.
Yeah.
I mean, and it would come and go, and it would move from place to place in my body, and I was just absolutely miserable every day.
That's one of the things, I guess an earmark of fibromyalgia is that, and I talk about this in the videos, but it's like, your wrist is just killing you. It's like 3-4 days, and then all of a sudden it's completely gone and everything works right again. It's very hard for doctors to understand. It's hard for patients, and it migrates to a different area. And that's, the general overall inflammation. That's what you're talking about.
Exactly, and that's where the doctors would, they'd do x-rays. I had a couple of MRGs done, just all kinds of stuff. But everybody was just shooting in the dark, basically.
Okay. And so then you start getting desperate, and you start doing other, trying other things, even though sometimes they don't make sense, but you're probably just hoping it'd work, right?
Definitely.
And so then what was the one thing that did with, you had surgery?
Yeah, I had a spinal stimulator put in because besides the fibromyalgia, I also had some back problems due to a wreck that I was involved in. And they put in the spinal stimulator. It's been almost exactly 1 year now, and it helped tremendously in the first 3 or 4 months. But then after that, I think my body just got used to it, and they keep readjusting it and everything, but it's still not anything like what it was for the first 3 or 4 months. So it was helpful, but it wasn't a fix, that's for sure.
And so then we told you that you were a candidate. You had all the markers, all the parameters. We did the screening on you. Then we did all the lab work, and we found you had things that need to be addressed from the lab work. So on the labs, obviously, no one had ever run the labs like what we ran on.
No,
right?
not like.
And then we started working on the neurological part of it because the cerebellum wasn't functioning properly. So we've been doing that with oxygen, and we're doing all this. So talk about where you're at now.
Where I am now is just, I probably have 10% or less of the pain I had before.
Wow, that's good.
So it's a huge thing. Work every day is so much better. Before I felt like I was literally dragging myself around all the time, and I've got energy. I feel better overall. Another thing that it helps with tremendously is your state of mind. Because you do get very hopeless, going through all of that, and you start to think, this is it. This is what I got for the rest of my life.
Yeah.
And I'm seeing the light now, and it's it's great.
Yeah, and we still have a ways to go with you yet, you know,
Mhm.
but I mean, we've made good improvement on that. Okay, so as far as, you know, just your overall well-being, you know, I mean, I know this year you're getting out in the woods and hunting, which you haven't been able to do for a long time. I mean, you're
Yeah.
even thinking about doing. What other things has it changed in your regular everyday life? I mean, what are the things you're doing now that you just? I mean, we talked about work and just feeling good, but just other activities. I mean, that you haven't been even thought about doing.
Uh, well, one that's pretty small actually, usually, but for me it wasn't, and that was just being in a car for, a prolonged amount of time. Because before I could ride for like an hour, and we had to stop and get out and let me walk it off and stretch and all of that.
Because you were hurting.
Yeah,
Yeah. Okay.
just little things like that.
Yeah.
That makes a big difference.
I mean, people that don't have this don't understand how important that is.
Yeah.
I mean, just to be able to sit, like watching a movie and stuff, you know, I'm sure you had problems doing that.
Yeah.
Anytime you sit and move, and then all of a sudden the pain started intensifying, and then, so pretty soon, I mean, it just affects everything you're doing because you can't really do anything and have fun with that, you know.
Well, and my problem is I couldn't do any one thing for too long.
Yeah.
Whether it was sitting, standing, laying, I always had to be on the move
Yeah.
somewhat.
And that's just characteristic of the fibromyalgia because it migrates to different areas, and it's overall the inflammation level is so high, and that's what we've done through the neurological treatments, the oxygen, and the lab work, getting the inflammation down. So that's why you're feeling a lot better. Okay, well, we'll check in with you in a couple months because we've still got a couple months to go and see if we can't finish this off first. So right now, probably like 90% improvement.
Definitely.
Excellent. Okay. All right. So if you're interested in our program, again, you can go to TulsaFibroRelief.com. There's a report on there that you can download. If you know anybody else that has a problem, share this or send this to them because you could change